Well, good morning, good afternoon, and good evening, wherever you are, and welcome to UW Madison's Global Health Tuesday webinar series, which actually today is Wednesday, to accommodate some of our members through some of the travels and the opportunities that we have with our distinguished panel. And really want to thank you all for joining our webinar. And my name is Jorge Osorio. I'm the director of the Global Health Institute for University of Wisconsin. And today we will explore the importance of supporting sustainable global health. Our monthly Global Health webinar series features researchers and practitioners from the University of Wisconsin and around the world to highlight and examine the complexity of global health challenges and the many kinds of expertise that are needed to address them. Our foundation at UW-Madison is rooted in the Wisconsin idea, a practice which takes knowledge and research out of the classroom into real-world settings. And at GHI, we are conveners who believe addressing global health begins with investing in community-level conversations. We ignite and engage in collaborative One Health-focused discussions, where humans, animals, and plant health are all interconnected. And this approach can transform the way global health issues and solutions are viewed and connected through multidisciplinary and multi-sectoral approaches. Today's discussion will explore how can global health programs and networks be sustained to maintain global health. What kind of opportunities and organizations do now to mitigate health crises and grow their capability to react to health concerns and threats. But before we jump in, a couple of quick housekeeping items. We are recording today's session, and the archive video will be available at our website at ghi.wisc.edu. And second, we are monitoring the chat, so please share your questions and comments for the panelists here. So with that, let's get started. And we start today by introducing our moderator, Richard Gordon. Richard is actually right now in Senegal, and Richard, so much thank you for taking the time to join from your travel. He's the director of the International Business Development at the South African Medical Research Council. He's heavily involved in building capacity in Africa, as well as funded alignments to the Innovative African Health Research and Innovation Funders Forum Initiative. He was previously the executive director of the Grants Innovation and Product Development Groups at the South African Medical Research Council, and oversaw the majority of the group's international partnerships. Richard has led a lot of different international and local positions, including Ministerial Advisory Committee for Antimicrobial Resistance, the National Health Research Committee, Director of Technology Innovation Agency API Cluster Program, and South African representative to the EU for the Joint Program in Antibiotic Microbial Resistance. He's also a leader on the WHO mRNA Lipid Consortium, which I had the opportunity to work with him on that as well. And he also has been very active at the University of Wisconsin, has been appointed with the Department of Biochemistry to support the development of new programs for us to expand global health into South Africa. Thank you, Richard, for joining us. We also like to welcome Karlee Silver. Karlee, it's nice to meet you here, and thank you so much for joining us. Karlee is the Chief Executive Officer for Grand Challenges Canada. She's a mission-driven leader committed to addressing inequity through innovation, power shifting, and internships. Karlee has been at the Grand Challenges Canada since the beginning and leads the process of selecting the organization's prioritized Grand Challenges and setting the strategy for global health development and humanitarian innovation initiatives. She has enabled the program's investments and knowledge management teams to source, support, and transition to scale promising innovation for social impact in low and middle-income countries. Karlee is also an active member of the Grand Challenge Network and the International Development Innovation Alliance. She's a co-CEO. As a co-CEO, Karlee helped mark major accomplishments, including securing $300 million in funding to support innovations in low and middle-income countries, strengthening the relationship with partners and funders, including Global Affairs Canada. Karlee also received her doctorate degree at the University of Oxford, where she attended as a Rhodes Scholar and trained in genetics in England. Welcome, Karlee, and thank you so much for joining us. And finally, we have Ramanan Laxminarayan, who actually we met a few years ago. And Ramanan is the founder and president of the One Health Trust, funded the Center for Disease Dynamics, Economics, and Policies. And he's a senior research scholar at the Princeton University, an affiliate professor at the University of Washington, and a senior associate at the Johns Hopkins Blooming School of Health, and a visiting scholar at the University of Strathclyde in Scotland. He is the chair board of the Global Antibiotics Research and Development Partnership, which was created by the World Health Organization and aims to develop and deliver new treatments for bacterial infections. Ramanan has worked to improve the understanding of antibiotic resistance. This work includes peer-reviewed research, and also, in fact, you have been given a TED Talk, which has been viewed over 1 million times and has is very involved in policy engagement, involving presentations that he gave at the United Nations Assembly in 2016. So, Ramanan, thank you so much for joining us. So today I'd like to begin our conversation, and then I'll turn it over to Richard, which will moderate the discussion. Thank you, Richard.
Thank you, Jorge. Very nice to meet you, everyone, and thank you for the panelists, Ramanan and Karlee. Looking forward to spending the next sort of 45 minutes with you all to take you through some of the things that I think are very important when considering about sustainability. And we chose sustainability. I'm showing some slides. We chose sustainability because it's something that many of the funders struggle with, and it's something that Karlee and I have spoken for many times over the last sort of decade. We've kind of worked together. So I'm just going to, I don't have many slides. I just thought it'd be useful context to illustrate what we wanted to talk about. And I'm going to really maybe anchor it on a couple of examples. This one in particular is around the Grand Challenge of South Africa. The picture on the top right-hand side was when South Africa joined in 2014. And the Canadian health minister is there, obviously some well-recognized people. The late Raj Bhan is there, but that was really where it kind of started for all of us. And what I picked up is on some of the things we experienced over the years when trying to scale innovations and scale innovations in Africa, and give you some of the lessons that we learned. So I'm trying to get me to the next slide. Is it moving to the next slide? Let me try it a different way. Sorry, my computer is not wanting me to advance it. Sorry, I'm going to try that once more.
Okay, maybe you can do it.
Yeah,
I'm going to just try it once more. If it doesn't work.
If it doesn't work, let me know. I'm happy to jump in.
Okay. Okay, so for some reason my screen is not showing, but that's okay. I only had a couple of slides. So maybe
we'll check your screen, Katie, if you can.
Yep, I will.
Okay. Thank you. Maybe we can just toggle through to about the fit slide, please.
We're seeing the speaker view, Katie, just so you know.
Yeah. Put on us.
If you can flip it and put the.
Katie, don't worry about that. You can take the slides down. I will. You don't need to project. Thank you.
Okay.
So essentially, the three things I really wanted to talk about when it came to sustainability, and I'm sorry my slides weren't progressing. The first thing is when it comes to considering a place like Africa, Africa is not one country. Africa is a collection of 54 countries. Therefore, when it comes to innovation and scaling of innovation and things like sustainability, you need to be thinking quite differently. That if you were in India or in China, which is over a billion people within a defined country, or a high-income country like the US with 350 million people, it's a very different economic model around sustainability, and it's a very different way you often have to do things. So that is the first kind of key thing I would just like to highlight to many of the people on the call when it comes to globalization and health and sustainability from the funding side. The second one is that how just because you can manufacture things in certain part of the world doesn't mean people get access to it. I think COVID was the real example of that, where many of the world struggled with supply to essential vaccines, drugs. A lot of Africa, you could not get paracetamol throughout the COVID years, in the way that the drugs and supply of manufacturing of new chemical entities, drugs, vaccines, etc., diagnostics, the reagent kits, etc. So really was just because you can manufacture in certain parts of the world does not mean the world gets supply. And the last thing really to point out was in terms of the supply model and sustainability is really relies on networks and networks of funders and different kinds of funders at different stages in the network. It's very seldom you go to a meeting where you will have a development financer in the same room with a philanthropy, as the same room as a government funder, where you are all talking about the same topic. So, for example, vaccine manufacturing, it's topical, it's a global topic, but you do not get the development finances who typically fund in the hundreds of millions of dollars ever in the meeting, the same people who do capacity development and the same people who fund tech transfer. They normally have their own meetings, they're all done separately, and they never ever meet. So what then happens, the world that we kind of live in is quite a siloed world of funders, where there is opportunity and opportunity lost. So that's really what I was going to use as a place to anchor these three presentations about how do we get sustainability in low and middle income countries. Really around alignment of funders. It's understanding the markets that you're working in and the root sustainability. I forgot the last one, but I will move on. So I'm really going to hand on to Karlee to talk about a Grand Challenges Canada approach. Grand Challenges, I've been very fortunate for having known Karlee for probably nearly 10 years, and they do things very differently and very much thought leaders in many of these processes and how they challenge them across the world. So Karlee, very keen to hear what you guys are doing, the thought processes behind how you do it, and we'll pick up the discussion from there.
Amazing. Thank you, Richard, and great to be here. I'm going to hope the technology gods are on my side. Can you see the slides? Yeah? Okay.
Yes, we can.
Yes, we can.
Okay, great. And I'll hopefully be able to advance too. So I love when you get topics that are like sustainability and global health, and it's just like, how do we put two massive ideas together and talk about them succinctly? But one of the things I love about this topic is because it's at the crux of, I think, a lot of how Grand Challenges Canada has been set up and how we do our work very deliberately. We're about 15 years old now. We were set up by the Government of Canada in a moment of having a little bit of extra money thanks to high oil prices in 2008. And some very creative bureaucrats saw an opportunity to carve a little bit of money outside of the government and actually task it with the opportunity of taking innovative ideas in global health specifically to start, but broadly in a development, overseas development assistance spending, in order to make the whole more efficient, kind of bring competition into the space so that the whole of the government's international development spend would be more effective. That's a big idea in itself, and we are still working on that. But in the ways that we've been doing it, we have had significant impact over those last 15 years. And the key crux of what we do has led us to some key stats that we're really proud of. First is that we've funded over 1,700 unique innovations around the world, and almost 2/3 of those are focused in low and middle income countries, led by innovators in low and middle income countries. And this is one of the key elements of our sustainability play that I'll get back to, of like who is actually doing the innovating that we're supporting. It's over about 100 different countries to date, and of where the innovators are, and implementing in over 106 countries around the world. So part of what Richard was talking about that like heterogeneity that we see in terms of how you can take approaches to scale and sustainability across different areas is something we play in a lot. Another core to our ability to be sustainable is the fact that for every dollar we get from the Government of Canada, we've managed to leverage $2.4 from other investors. That includes other governments around the world, philanthropy, and also private sector. That's either into Grand Challenges Canada or into specific Grand Challenge portfolios we fund, or into specific innovations that we fund. When we were set up with this context of wanting to solve big problems. That's why it's in our name, Grand Challenges Canada. And a grand challenge is a critical barrier that, if overcome, is more likely to increase social impact than other approaches that are currently taken. It's about a 110-year-old concept, but was very much brought back into the global health world by the Gates Foundation in the late or early 2000s. And the founder of Grand Challenges Canada was one of the people who helped define the original Grand Challenges in Global Health that launched in 2003 by the Gates Foundation. So we take that same approach of really focusing the minds of folks on specific critical barriers. But some of the things that we've inserted in that very quickly that brought difference to how we do it is that we prioritized innovators closest to the challenge right from the get-go. So from 2010 onwards, we were more interested in funding those who were right in the backyards of these issues that were being addressed, not isolating them, but connecting them into the rest of the world. But really putting the authority and determination into their hands from the get-go. I think the cool thing is that now that we're about 15 years down this journey, we've been able to track how the innovations that we funded in early days, and then at a transition to scale level, which is kind of the sweet spot we play in, which helps innovators develop their idea, their solution, build the evidence for it, build their partnerships and sustainability plays around it, but also build the organizational capacity to deliver it at scale and sustainably. And so we've now, a couple of years ago, we did an analysis of almost 150 innovators that had gone through that process, and saw that when an innovator was targeting a problem that was within their context, within their country, that we actually saw they were 2/3 more likely to be sustained in the long run, post-funding from Grand Challenges Canada. So kind of at a gut instinct, we knew this and we're backing this, but it's really nice when evidence starts to back up what you know to be a good thing to do. What we do is back integrated innovation, which is just a kind of catchy way to say we like when people solve problems, and it doesn't matter to us what problem they're in front of that they're solving, and it doesn't matter if they're bringing science and technology to the problem, or social innovation, or business innovation. And in fact, we think that when people are really pulling across different sectors and using cutting edge approaches to them, creative approaches, that they've got a greater chance for sustainable impact at scale. And then finally, what we do is this phased approach. And so our motto is kind of put a lot of things out there to begin with, see if there's any evidence to come back to prove that these approaches are worth sustaining. And then once they've shown that there's something to follow there, there's a way that we do this phased approach for financial support and technical support that meets the innovator where they are, meets the solution where they are, and helps take them to the next stage. So we always leave them stronger than we found them. And this approach means that there's a lot of back and forth in terms of how we engage with innovators, how we can help innovators connect with other innovators in the portfolio they're in or across the organization. And more excitingly, when it's connecting with other networks like that of the SAMRC as well. So just a few examples of ones that I think embody the idea of sustainability. Hewa Tele is a social enterprise out of Kenya. It started in one county hospital in Nairobi. The premise was trying to get a flow of quality medical oxygen right at the regional hospital. The county government gave land. Hewa Tele got funding to develop the plant that would go on top of it. And the government committed to buying, essentially being a market taker for the quality oxygen that was delivered and piped right into the hospital. This did a few things. One, there was a reliable source of medical oxygen that then could change the behavior of the health workers in the hospital to actually freely use oxygen, which was not a practice when the oxygen was unreliable. And secondly, that Hewa Tele was able to have any excess of the medical oxygen taken and sold to private clinics around, so that they were able to sustain their operations in a way that has helped them grow. They've now developed plants across multiple different countries in sub-Saharan Africa. COVID was actually a huge accelerant for them, and they've now just crowded in $20 million of equity investments in order to launch the second liquid oxygen plant in East Africa. And so this is the kind of thing where this is a going concern now. It does no longer need Grand Challenges Canada money, and they're in a completely different realm of support and success. This is a Colombian-based early child development innovation that we've supported from AEIO2. The key element here is, how do you develop and sustain quality childcare on a model that is not heavily subsidized by a government, which tends to be the only way that you can get quality early child development around the world, but it's not something that that can be sustained under many kind of types of governments. And so this organization has really been pushing the bounds on how do you really maximize for quality, as well as really maximize for sustainability. And they've managed to, after several years of funding and really testing different models of sustainability, have managed to land on something that is helping them sustain the original clinics that they have across Colombia, and are looking at how that's actually scaling into other countries as well. Last one, and this is one that we're particularly excited about at the moment, is backed by CEL Ventures in India. Their whole approach here is, how do they take the practice of skin-to-skin care, which is an evidence-based approach to supporting babies who are born too small or too soon to thrive, by having a lot of skin-to-skin care that allows for temperature regulation, healthy brain development, access to exclusive breastfeeding, et cetera, et cetera. And one of the biggest challenges that has existed in getting this life-saving practice scaled around the world is actually one that is more the aspirational element of incubators and care around very high-tech things in NICUs that people feel, moms feel, families feel is kind of the way they should have care delivered. So it doesn't matter how many awesome RCTs have shown that it's actually better, more beneficial for the for the baby to be cared at KMC as skin-to-skin care, then an incubator. That's where the aspiration lies. So at the heart of this innovation is really changing and making kangaroo care an aspirational product, an aspirational service, and providing a lot of support for women so that when they do have a baby, they actually want to do KMC and are supported to do it. For those of you who know the Indian context, the other amazing thing about this is that the leads under this or backing this have managed to convince the government of Uttar Pradesh to put a significant amount of money into scaling this across that state in India, which is no small feat, and also will have a tremendous amount of impact given the high mortality rates that exist for newborns in that area. Changing tact a little bit, there's a few kind of new areas that we are thinking about sustainability. One is in the context of climate sustainability and understanding how we can help innovators think about how to sustain impact in the context of when climate change is happening, and some of the things that the context that were 20 years ago much more stable or kind of a certain way. And now we're seeing higher influx of climate-related events or impacts because of climate change. And so how can we build this into models that innovators are thinking about? How do their solutions become resilient or adaptable? And how can we also be supporting innovators to think through ways that they can have less impact on the planet? So this is something that is kind of an emerging work for us. We have about 40 different grants out at the moment on this topic, but are also doing a landscape analysis for climate and health that will be launched in mid-January. So keep your eye out for that. There will be a link in Lancet Global Health around it, and we would love anyone who has input on what the critical barriers in climate and health might be to input on that and share amongst your networks. Final one that I will talk to is around innovation ecosystems. At the end of the day, for innovations to scale and for us to have sustained impact anywhere, you need the systems that are actually strengthened and conducive to scale and to uptake of innovation. This is something that I'm not sure any country in the world has really nailed as to how to make sure in a kind of peacetime world that we are really being mindful of where innovative approaches can be hugely beneficial to our systems. I'm speaking from Canada, and the amount of times I get frustrated with thinking about how our publicly funded healthcare could be much more efficient if some of the innovations that we support innovators around the world to come up with are actually used here in Toronto and other places in Canada. But I do think that there's some real opportunities here, and it goes to the idea of there's lots of openness for innovation, but there's a lot of barriers for it. And how are we thinking about being able to play at a systems level to catalyze local demand for scale and sustainability in different contexts? So this is something we're taking on over the next 5 years. We've done some work initially working with some of the counties in Kenya that has led to how procurement mechanisms are being used for taking up innovation in a way that fits with policy. And as one of the things which I'll end on here, given it loops back to Richard, is one of the ways we've been backing local innovation ecosystems is by supporting Grand Challenges Senegal. It's one of the newer Grand Challenge family organizations based out of Institut Pasteur Dakar in Senegal. And we've been backing a few rounds of their innovations that are defined very much on the types of challenges they're seeing locally. And it's been a great way to start and to help them succeed. So I'm going to end there, but happy to carry on the conversation.
Thank you, Karlee. Can you hear me?
Yes.
Sorry.
Yes, we can.
You first, but thank you, Karlee. And it is actually ridiculous since I've literally 30 minutes ago saw Joe Fitchett in Senegal. So very, very small world indeed. Thank you so much. We're going to ask you questions in a little bit, if that's okay. But that's a great way to kick us off, just to show, examples from across the world, different contexts, different settings of how they can be successfully implemented. So I'm going to stop there, and I'm going to pass now to Ramanan to give his experiences for sort of the next 10 minutes. And then we're going to have some questions and discussion, and I'll kick it off with a few. Thank you. You're on mute, Ramanan.
Oh, thanks, Richard. It's great to be here. And we were part of an early part of the Grand Challenges journey with Karlee. I think when she had first started at Grand Challenges, might have been her first year then with the Saving Brains project, which was a whole set of work that we were able to do with support from Grand Challenges, Gates and others on early child development and interventions on nutrition, on vaccines, and various other interventions to look at long-term outcomes for kids. So thanks, Karlee. I think the Canada Grand Challenge has made a huge difference in our ability to do some of that work. I think IDRC was also supporting you back then. So I have to admit, I was a little, as always, I started thinking about the talk only like an hour before. So, and I was a little stumped by this one because what is sustainable global health? That's a tough question. I think, as Karlee said, taking very big ideas of sustainability and global health, and you're sort of, trying to see what makes sense. And I guess my take is very different. We're not a funder. We would love to have the kind of money that Karlee does, but we're at the other end. And it's been a journey for us in terms of being an organization, the One Health Trust. The One Health Trust is about 55 people working on, very typical sort of global health type work, whether it is disease modeling, epidemiology, data collection, working on, field studies, but also working, with governments, with national action plans in the context of antimicrobial resistance, to make a difference in terms of both publishing high quality research, but also trying to connect to the ground in order to make the change that is essential. So it's actionable research, and what makes the One Health Trust an easy place to do it. It's a fairly flexible organization, and we have a lot of people who hold secondary appointments at universities, like myself. But we also use this as a platform to do what we need to do. Now, sustainability is a big question, and in some sense, we're sort of on with blinders when we think about global health. We have a certain set of indicators. We say this is what we want, but the fundamental question is the size of human populations itself sustainable? We have a huge population already. It's growing to 9.5 billion by 2050. A lot of them happen to be here in India, where I spend most of my time. And what does global health mean in that context? What does it mean for these kinds of populations? What does it mean in the context of humans constituting more than a third of the biomass of all mammals on the planet, and of livestock that humans eat, mostly cows and pigs, accounting for 60% of the biomass, and wild mammals only for about 4%. Biomass of poultry is about 3 times higher than that of wild birds. So we have a situation where we've literally occupied the planet, right? So we've taken over in terms of most of what there is. And there's wild animals, is everything, every zebra, every leopard, everything that you thought of is really in that bunch. And all the other mammals, whether elephants or whoever else, is all in that remaining 6%. So we're 30, the domesticated livestock are 60, and then the remaining is just about 10. And when you really think about what global health really means, we live in a world where we equate global health very much with very technical interventions. We all work on these. This is not to sort of, say that this is not important, but it's also important to look at the history of what brought infectious disease rates down, say, in the United States. It was not the kind of technology that we think of. Most of it was simple stuff like chlorination of water. It was about public health departments. It's just about sanitation and hygiene, right? And things like vaccines and antibiotics came much, much later. Now, today, when we attempt to do global health in many countries, including India, for instance, we are trying to introduce these technologies as some sort of a substitute for the very basic stuff of just having hygiene, right? You can't just solve polio with vaccines when you've got, sewers that are running everywhere and people are exposed to them, right? People are exposed to the environment in all places. And I think we've lost some sense of what it was that made public health work in places where mortality rates came down. It was not technical interventions. It was just about sanitation and hygiene. And today, those are not the sexiest jobs to have in any of these countries. You can discover a vaccine and get famous, but if you cleaned up, the local sewers in Bangalore, for instance, no one's going to make you famous here. So I think we also need to sort of think back to see what made the biggest differences. And we've overemphasized some set of things, which obviously, are things that are easier to measure, things that are easier to pitch and sell, but not necessarily the things that had the biggest impact. Now, our connect to the environment is also, growing in understanding, but something that has always been known. So I don't know how many of you are familiar with this. So diclofenac is basically it's a pain reliever. It's a muscle relaxant that people use, but it's also used in animals. And when cows are given diclofenac as a medicine, or livestock are, and vultures feed on them, vultures die from this. And in fact, most vulture populations in India nearly became extinct because of diclofenac, this one drug. Now, about 10 years ago, there's been a ban on diclofenac, so these populations have started reviving. But having vultures is very important because they are like a cleanup crew. They're sitting there and, they make sure that if there are dogs that are dead, if the carcasses are not lying around. And this is an example, it's not one of our studies, but a recent study which showed that in Indian districts that were highly suitable to vultures, there was an average increase in human deaths of about 4.2%, or about 104,000 additional deaths each year because of the extinction of vultures. Now, there's lots of links that come back between what we see in the environment, and we've sort of assumed that global health is not what happens out there, but it is, as we're now rediscovering with One Health. There's lots of other examples. This is a very nice study in a very obscure journal, which talks about dung beetles. Now, dung balls from dung beetles, if you've ever seen one, you've seen these little beetles rolling these dung balls, which are much bigger than them. And, dung beetles can bury dung about 250 times their own mass in one night. They're very hard workers, and, they will show it off to a female as a way of sort of, getting the opportunity for a mating. Sometimes it works, sometimes it doesn't. But they're worth millions because when dung is left unmanipulated by dung beetles, it naturally decomposes. But when it has, when you have a high abundance of dung beetles, then they decay much faster. And what you see is that livestock don't like to eat grass next to where they have pooped. They're not very different from us in terms of hygiene in that sense. So if you have a lot of dung lying around in pastures, then you've got much more limited grazing opportunity for livestock. And so when you have dung beetles, you enable many more cattle to be raised. This was actually covered in The Economist, which is why you found this paper. And there's also reductions in fungal disease because if you just let the dung lie around, then it is prone to be then taken over by fungi, which then cause disease as well. So again, fascinating stuff. And we're just beginning to understand these other connects, which really seem to be quite important in what we think of as global health, not our traditional global health. This is not the stuff that gets taught in any class in global health, right? But it seems to make a difference. So as part of our own journey here at the One Health Trust, we've been interrogating this question of, is sustainability necessary for global health? So in other words, what is sustainability really all about? And how does it, can you really have global health without sustainability, without sustainable living, for instance? Or is this just a constant consumption exercise where you essentially end up in a place where you're going to have more and more fixes? So you take Delhi, for instance, the AQI there is probably 2,000. the meters, if you've been watching the news, you can't breathe in that city. So yeah, you've got development. India is the fastest growing large economy, but people are choking to death. You then will have to have air pollution filters to allow them to breathe. Where does this really end? You've got high rates of emphysema, COPD, all of this stuff. And it's unclear whether the pathway that we're heading on with the lack of sustainability is really conducive to any sort of sustainable global health at all. Now, this is a quote that you all might have seen from Chief Seattle, which after whom Seattle is named, which is really the definition, in a sense, of what One Health is, which is we're just a strand in this web of life, and whatever we do to this web, we really do to ourselves. Now, our work has been primarily on things like climate change, pandemics, drug resistance. We do very sort of bread and butter kind of epidemiology and disease modeling and that kind of work, which sorry, I lost my screen there, which is fairly routine type stuff. But a few years ago, we started to move away to keep that, but also to sort of look at interrogating what One Health really means for us in a very clear way. We weren't interested in someone else's definition of just One Health, and One Health itself is a evolving sort of an idea, right? For us, it was just the idea that we need to look broader than human beings to see what healthy living is broadly for the planet as a whole, and how do we then use tools from economics, epidemiology, disease modeling, risk analysis, medicine, veterinary sciences, and GIS and stats, all of which are skill sets that we have in our teams to conduct actionable and policy-oriented research. Now, these were our areas of research, but we've sort of started moving into more things which are about changing human diets and planetary health, soil health and regenerative ag, things which people say, oh, but is that really global health? Is that really public health? And to me, it's increasingly becoming public health because it takes some understanding to say, well, soil health is really what determines nutrition and human health. Until now, we've just thought of productivity as really being what drives, improvements in nutrition. But then we don't look at quality of nutrition. But when you look at the Eat Lancet Commission and those kinds of publications, I think people are arriving at this fact that you really have to think about this in a way which starts very early in the production systems and agriculture to get to the right kind of nutrition, which then is the kind which is going to prevent disease, rather than trying to deal all of these in a sort of exposed kind of a way. So this is the kind of work that we've sort of been into. And to facilitate that, we looked for a place where we could do this kind of work. And so here you're seeing the hills. I mean, they're not so small. These are all about 1,500 meters above sea level, around just north of Bangalore. And this is where we've sort of set ourselves up in a new campus, which is really meant to be what we're trying to do is really interrogate this question of sustainability in everything that we do, literally everything that we do, and find a space in which we can do the research. Because I think unless we have that part of an internal process in ourselves, we can't just write papers and advocate for it. It just seems somehow, dissonant. So somehow being in a glass and steel building and not being in a sustainable place, but then going out there and being at conferences or giving these talks or being on boards and saying things which are not consistent with the way in which we ourselves are living. Some of us, I mean, obviously we justify it ourselves. We all fly a lot. We all do things which, we wouldn't consider sustainable practices, but somehow we've not really reconciled what we do with what we're really trying to advocate for. So this is still a little bit under construction. Some parts are, we're right against the hills. And we started from the beginning in this process. So this Center for One Health, every single brick on this campus was really made from the soil of the campus itself. We dug out 4 lakes, and they were all sort of, using this process called compressed mud blocks. So we said, how can we build in sustainability right from the foundations, from the very beginning? Yeah, we minimize the use of concrete, but then we design buildings in ways that are very, very low carbon footprint. So we start from this, which is we made 400,000 of these bricks. Unfortunately, they have to be made by hand, as you can see. But the entire campus is built, that way. So these buildings that you're seeing here, which is the entrance as it happens, is made from compressed mud blocks. It looks beautiful when it's done, actually. We've used local materials on everything. It's all culturally relevant because we also needed to connect with our local populations. If you put up something which they don't really see as being a familiar space, they're not going to come in and engage with you. So we had to do that. We're 100% sustainable for energy. That's the easiest part because that can be done with solar. We're climate positive, which means that our carbon footprint is actually negative, once we sort of account for everything. There's no word for it, but we're really a water zero campus. In other words, we have no pipe water coming in from anywhere. All of the water on site is basically through rainwater runoff collection. It's from, refilling our ground aquifers. And basically, we're completely self-sufficient for water, 100%. And we also have about 5 acres of organic farm. So all of what our campus uses for food is also completely circular. Not 100%. It'd probably be about 80 to 85% that most of what is served there is all been grown on site. Again, not the sort of thing that you think of as something that a global health place, is usually doing. But we just thought that if we don't start from that space of interrogation ourselves, it's a lost opportunity and we weren't being true to what we really want to set out to do. So we do have a global research program. It is set in India, but all of our projects are supported, apart from grant challenges many years ago, from Gates and NIH and NSF and CDC and Wellcome and all sorts of global funders. We have a very active component of local community engagement because unless we engage on improving well-being of the 13 villages around us, which is about 10,000 people, we really aren't doing what we need to do, for our place to improve well-being there. We run a PhD program in data science for global health. We have student exchange programs. I teach my class on, Princeton students over there. So there's a lot that's happening already over here. We run a One Health demographic surveillance site, which is on longitudinal data on resistant pathogens in humans, animals, and the environment. The catchment area is because we're sort of close to a city, Bangalore. We're rural, but we're not that far from the city, and we're only about 40 minutes from the airport. But it does cover livestock health. It also covers soil health, which is a critical part of regenerative ag and our soil health initiative. Like I said, we have free cancer screenings for the local community, NCD screening in the populations. We're starting a clinic for livestock health. We had one and then we closed it while our construction was going on, and then we're going to restart that again. And our soil health initiative is really to work with local farmers to integrate traditional and modern approaches to regenerative ag, which is something we're fairly serious about. So this is just a journey. So it's sort of, I don't know how to put it. It's really it's sort of a, it's still work in progress. And I think we're learning a lot in terms of how all of this works out. But this is sustainability to us. Thank you.
Thank you very much. I'm going to be heading off quite shortly, but I have to ask 2 questions to each of you, if I may. Thank you. So my first question will hopefully be a very simple one to Karlee. Well, first of all, thank you to both of the speakers. I thought they were very, very interesting and two very, very different presentations. So, and which makes this all the more worthwhile while we were doing this. Karlee, my question for you really is, you mentioned a much higher success rate of uptake of success of the programs, almost 2/3. Why do you think that is? Is it more uptake and support from the local government? I mean, that's quite striking, but that's actually really important to nail down. That's my question to you. And then if you can respond to that, I will ask then Ramanan my question for him.
I think it's twofold. I think we are seeing more support from public systems that are in context for local innovations. But I think the second thing is that the innovations themselves are more compelling to other funders to keep them going. So that they're working better, they seem to have higher impact, and are really kind of getting at some of the use of assets that are already in a certain context in order to make them go further.
Thank you. That was fascinating. And Ramanan, my question for you, bringing a very different view to some of these big challenges, and I really appreciate some of the questions that actually be looking in the wrong places in lots of these kind of diseases. So I suppose in a kind of utopian world, and bearing in mind that University of Madison, Wisconsin, the folk on the call here as well, is one of the few places that has a medical school, a veterinary school, and an agricultural school. What kind of the key research areas do you think you can go into along the ones that alluded to in your discussion, where you're going to get your best bang for your buck in this kind of one health approach? Because I really think it's quite a refreshing approach that you have presented in, and not many people think like that.
Well, I think the advantage, as you point out, of having a strong veterinary school and ag program is significant because the biggest room for transformation over the next decade or two, I think, is really, as far as health goes, is really in nutrition, as far as LMICs go, and then in agriculture. We're in a place where the agricultural system neither serves the need for sustainability or climate. It contributes about 20% of global climate emissions, including significantly from livestock. It also doesn't contribute to human health in a much more direct way because it's not producing the food that's essential for human well-being. We've all read Michael Pollan's books. The over-reliance on just corn. The entire system, particularly in the US, is locked into this large monoculture, corn, soybeans, which is historical, but that just has to change. It just has to fundamentally change. And in order to make that transition, someone has to show that farmers and consumers are better off from moving from this very chemical-based agriculture, which separates livestock and farms, to something which is scalable, can feed the entire planet, but which is much more sort of sustainable, to use that word again. We're doing this on a small scale. I don't know a thing about cows, but suddenly we have 5 cows, and because we can't really figure out this entire circularity until we figure out how to do ag, which is good for the next century. And the ag that we're doing right now is just not sustainable at all. If I have 30 seconds, one of the reasons why the air quality is bad in Delhi, for instance, is because of crop burning. Crop burning happens because rice, stalks are burnt in order to make room for the winter wheat crop. The reason the rice is burnt now and wasn't burnt 15 or 20 years ago is that they had to shift the rice growing season back about a month and a half so that farmers wouldn't rely on groundwater, which they were exhausting, in order to be able to use the monsoon water so that can be rain fed. So you have a situation where groundwater depletion is causing COPD in Delhi, right? We never think of that connection. That's really what's going on here. And we just have to think of these in slightly more holistic ways. And I think Wisconsin's very well placed with all of their different schools to be able to do this.
Thank you, Ramanan. I'm going to be jumping off, and I'm going to hand over to Jorge, but I think funders play a fundamental role here as well, to realize that these things are connected, right? And not to be silo veterinary, agriculture. The funders have a big role to play in this as well. So please excuse me, everyone, but this has been a fascinating session.
Thank you, Richard. I'll take over from here. And as remind the audience, please make sure you post your questions on the chat on the website, on our chat on the webinar, man. And so we have a question from the audience. It talks about rebuilding in situations where we have earthquake reconstruction. Okay? And it says, became much evident that to build sustainability skilled technical work was so much lacking locally. How do you suggest that we improve this? That comes from Kathmandu in Nepal.
Yeah, I can
Anyone
take
can
a
take
little
it?
crack at this,
Excellent.
given I think I was the one who mentioned technical assistance stuff. But you know, my head goes to two places. One is how do we get to the place where we understand what are the potential shocks that are occurring in certain places and building for those, so that we might build in different ways in places where you're more prone to floods versus earthquakes versus things like that. I think that's one element. The second is we have a humanitarian challenge that's focused on creating hope in conflict, but the premise I think is one that we've been challenging ourselves on as well. Is a lot of the humanitarian world and assistance in the world is really like a lot of jumbo jets of people coming from elsewhere and being deployed in context. And the coordination between the different responses are very messy, and there's a lot of problems with that. And it's highly inefficient. And so thinking through in every place in the world where there is conflict or there is crisis that's happening, there are local resources that that come up and start responding. And how do we think about scaling those versus scaling the kind of huge descending in jumbo jets onto places? So those are not solutions, but like maybe challenges of how do we prevent, and then how do we use kind of more local approaches that there is indigenous knowledge there for.
Great. Yes, definitely
Need to
true,
run
Karlee.
Windows on your Mac? Parallels Desktop makes it simple to integrate.
Sorry. I do have a question for both of you, and I'll start with Ramanan. And it's about what do you think are the big challenges in the future for sustainability? From your end, you are implementing sustainability, right? And from Karlee's end, you are funding sustainability. And so if you can both think about the big challenges in the future, what you see coming. Ramanan, you go ahead first.
Sorry, future challenge sustainability was your question?
Yeah, future challenges for sustainability that you see.
Karlee, go ahead.
I mean, my mind goes to, I think, a little inspired by Ramanan's talk as well, is how do we, some of the ways that we think and are taught to think, how do we challenge that? And I get a lot of inspiration. We also host Indigenous leaders and have an Indigenous Innovation Initiative for First Nations and Métis and Inuit people here in Canada. And when they sat down to do a strategic plan, we were hoping for 5 years. They started at 400. And that's, I think, the kind of thing. And so like Ramanan saying, how do we link the water with COPD, but also like the time scale on which we're thinking? I think there's a lot we can be inspired by societies who have managed to sustain themselves and be resilient in a long time. So.
Thank you, Karlee. Ramanan, what are your takes on that?
Yeah, I think Karlee's absolutely right. Whether we realize it or not, we belong to a very small set of English-speaking, people educated in a small set of institutions with very limited knowledge in some extent, trying to solve problems which we don't even really deal with on a day-to-day basis. There's a lot of people out there. They're conversing in many other languages. They're not necessarily reading what we're writing about. And I think that we've left too many people out of this conversation. I don't mean this just in the sense of kumbaya, we all need to be sitting around the campfire. I really mean that many of these solutions are just there in other worlds that are operating just really well, and they are thinking about these kinds of solutions as well. But if you're talking about sustainability challenges, I think the one that I laid out, which is the fundamental one of ag transformation, it's coming. The ag transformation has to come because the collapse in food systems will happen extremely fast. If we read Jared Diamond's Collapse, civilizations don't collapse like this. They just go straight down. And typically they collapse at the point where they're doing the best. So you look around and you say, oh, but we're doing great. People don't realize that agricultural productivity in India has been flat for the last 15 years, absolutely flat. In tropical countries, which are facing climate change, that's an absolute disaster that's just waiting to happen. Across the tropical world, there's about 1.5, 2 billion people who depend on agriculture directly. Now, what are those folks going to do when, you know, climate change really just completely wipes out their rain-fed agriculture? We just have no idea. I mean, we only see the conflicts. We see what's happening in Syria. We see these other conflicts. We don't understand the water behind it, you know, the land issues behind it, which is what drive a lot of these kinds of conflicts. And I just think that as public health people, we really need to sort of step back and acknowledge many things that we have just not thought about and that we don't even know about. And we need to engage in a much broader set of radical listening conversations to really get at what it is that people see as important as health. Now, we just go and say, oh, but they're so stupid. They don't understand that antibiotics, you know, should be used appropriately. Now, we can take that tack, but there's a reason why people use antibiotics the way that they do. That's what makes sense for them in their particular context. And if we lived there, that's what we would do. And, you know, I'm just in this sort of time when I'm realizing that many of the things that we're not able to solve is not because the solutions are not being accepted. It's because I think we have the wrong solutions.
Thank you, Ramanan. And I think that's all time we have today. Thank you to you, to Karlee, to Richard, who had to leave, but also to all the audience that was able to join the webinar. So thank you so much for participating in the webinar. I wish you happy holidays, and we will connect again for webinars next year. Thank you so much.
Right. Well, at least good to see you, Karlee, and good to see you, Jorge.
Thank you so much.
Thank you.
Thank you so much.
Bye.